All right, some news that came this morning a few hours ago. The FDA gave official approval for the use of the Pfizer vaccine. Remember, it had been under emergency approval, right? Back in December. More than 200 million doses have already been administered in the U.S. since that time. So with the FDA now officially signing off on safety, will that help convince those who have been hesitant to finally get the shots? Here to talk more about that is Dr. Suman Radhakrishna, Director of Infectious Disease with Dignity Health, a familiar face on our air, and a delight to see you, Dr. Radhakrishna. It's been some time.
Thank you for having me, and it's been some time, Michaela. We have good news.
No, this is good news. So maybe put it in context for people how significant this official FDA approval is.
So let me just start by what does FDA approval entail? You have a new product. You have to show that it works and it is safe. And that usually takes time. But if you have a new product that actually saves life, then they can start off with this emergency use authorization. And with that authorization, they can quickly enroll many more people, which we were all enrolled because we got vaccinated. And they looked at safety issues with us as well as the original people who were in the study. And based on that, in about 6 to 8 months, they can give us the full approval, which is what happened. If there was no emergency use authorization, then the vaccine would have been approved by now. But the problem is, think of all the
lives that
numbers
would have
of
been
people,
lost, right?
Yes, who would have died. That's what the approval process requires. Now that it's been approved, anyone who was skeptical, thinking, oh, this is something experimental, I do not want to be part of an experiment, you do not have to worry about it.
Well, and that's the thing where I think there are people like you, medical professionals, that are breathing a sigh of relief that this came. This happened in the timeline that it generally takes, correct?
That's correct. This happened in the timeline it generally takes. It's just that all of us got a chance at being protected before it could be approved.
So now the next question is, Moderna and Pfizer, they will be the next ones that will be up for consideration of Moderna and Johnson & Johnson, pardon me, they will be the ones that will be on deck to be approved as well. I understand Moderna filed for official approval in June, so it'll take a little while for that to happen, correct?
That's correct. Remember, it's about 6 to 8 months, and there is a requirement of how many people were enrolled. So those numbers are all coming in, and they can go ahead and get them approved.
And how much are you anticipating this will change some people's minds?
I hope it does. And we are sincerely hoping that anybody who's on the fence about either vaccinating themselves or their children because they were worried that my 16-year-old, my 17-year-old does not need to be part of an experiment. Now they are not parts of the experiment. Please go and get yourself vaccinated. We see a lot of people in the emergency rooms and in the hospitals talking about how they wish they were vaccinated when they come in with presentation of COVID. And let's not leave it to too late.
No, we don't want it to be too late for those people who are sick. And look, we understand that the people have been afraid and people have had their concerns, and you're allowed to be skeptical. You're allowed to ask questions, and hopefully this will help you feel better about making that decision. Do you think that because of this official stamp of approval from the FDA, this will lead to more mandates for vaccination proof? In whether it's school districts or businesses or in organizations? Do you think because they now can say, well, look, it is FDA approved, so we can now say that you must be vaccinated in order to enter our business or enter our organization?
You know, mandate usually brings in that negative feeling of somebody's forcing me to do something. And we hope that we don't have to resort to mandates, but instead have people accept it and go on and say, yes, it's safe. Yes, you can do it. And yes, I should do it.
All right, well, let's see if we hear anecdotally from medical professionals like yourself in the next coming, I guess, weeks and months, if more people have now said, okay, I'm ready now. I needed that stamp of approval, and now I'll get the vaccine. We'll see if that happens. Dr. Radhakrishna, really a delight to speak with you. Thanks for jumping on to talk to us.
Thank you for having me.
Absolutely.